A sinus infection, also known as sinusitis, is an inflammation of the tissue lining the sinuses, while a common cold is a viral infection that affects the upper respiratory system, including the nose and throat. Sinus infection symptoms often include a stuffy or runny nose, accompanied by pain and pressure in the face and possibly a fever, while symptoms of a common cold are similar but usually include a sore throat and sneezing without the intense facial pain. Treatment for a sinus infection can involve decongestants, pain relievers, antibiotics if caused by bacteria, and sometimes nasal corticosteroids, whereas common colds are typically managed with rest, hydration, and over-the-counter cold remedies. Individuals with allergies, a deviated septum, or those who smoke may have an increased risk of developing sinus infections. Understanding the differences between these two conditions is important to ensure appropriate treatment and relief from symptoms. Here's a detailed exploration of the varied aspects of each disease to help you differentiate between them. Infection localization, sinus cavities versus upper respiratory tract. When distinguishing between a sinus infection, sinusitis, and a common cold, infection localization plays a critical role. Sinusitis specifically targets the sinus cavities, leading to symptoms such as facial pain, pressure, nasal congestion, and purulent nasal discharge. These symptoms often persist beyond the typical duration of a cold. In contrast, the common cold primarily affects the upper respiratory tract, with symptoms including a runny or stuffy nose, sore throat, and coughing, which typically resolve within 1 to 2 weeks. While both conditions can share overlapping symptoms like nasal congestion and headaches, the persistence and severity of symptoms, along with localized pain in the sinus regions, are more indicative of a sinus infection. Discharge characteristics: thick and purulent versus thin and watery. When distinguishing between a sinus infection, sinusitis, and a common cold, the nature of the nasal discharge can offer a valuable clue. A sinus infection typically produces thick and purulent, pus-like discharge, often yellow or green in color, indicating a potential bacterial infection. This discharge is the result of the immune response to the bacteria, leading to the accumulation of white blood cells and other substances within the sinus cavities. In contrast, a cold usually presents with thin and watery nasal secretions. This difference reflects the body's reaction to a viral infection, with the increased nasal mucus serving to flush out viral particles and provide a protective barrier. Fever presentation, low-grade versus rare. When differentiating a sinus infection from a common cold, the presence and degree of fever can be a telling sign. Sinus infections, or sinusitis, can induce a persistent low-grade fever as your body tries to fend off the infection. This type of fever is generally not very high but lingers, reflecting the body's prolonged battle against the bacterial or viral invaders within the sinus cavities. In contrast, a fever is rare in cases of a common cold, which is typically viral. Colds may trigger a slight temperature increase, but significant fevers are uncommon. The subtle nuances in fever patterns can therefore provide valuable clues in distinguishing these two conditions, enabling more appropriate and targeted treatments. Duration, weeks versus days. Sinus infections, sinusitis, and common colds are often mistaken for one another due to their similar respiratory symptoms, such as a stuffy or runny nose. However, a distinct difference lies in the duration of the symptoms. While a common cold typically resolves within a week to 10 days, the symptoms of a sinus infection are more persistent and can linger for several weeks. Colds tend to be more acute but short-lived, whereas sinusitis can drag on, causing discomfort such as facial pain or pressure, potentially requiring a longer-term treatment approach, including antibiotics if the infection is bacterial rather than viral. Recognizing the longevity of symptoms is crucial for proper diagnosis and management. Discharge characteristics: thick and purulent versus thin and watery. Sinus infections, also known as sinusitis, typically present with a discharge that is thick and often purulent, which indicates a possible bacterial infection contributing to inflammation and blockage of the sinuses. The color of the mucus in sinus infections can be green, yellow, or white. On the other hand, a cold commonly caused by a virus usually produces a thin and watery discharge. Nasal secretions from a cold may start off clear and become thicker as the cold progresses, but they typically do not reach the consistently thick and purulent stage of a sinus infection unless a secondary bacterial infection develops. Understanding these characteristics aids in discerning between the two conditions, guiding appropriate treatment choices.